All right, Mr. Mitchell. So after looking at all your labs, everything seems to be within normal limits. Um, and due to this reaction that you had with the lip swelling, we do think that it is due to the ACE inhibitor you're on, your benazepril. Angioedema is a side effect or adverse reaction to taking the medication. Even though you've been on it for a year, it still can happen. We don't suspect that you had any sort of anaphylactic allergic reaction. And we're going to continue monitoring your airway. We're going to check a few more labs in the morning, but we are going to admit you overnight just to make sure that the swelling does improve and doesn't get worse, because we wouldn't want to send you home and for your airway to close up or anything, which we don't think is going to happen, but we do want to continue to monitor you. When it comes to eating food next, I'm going to put in an order to do a swallow test just to make sure that everything is going down fine, so that nothing gets stuck in your throat. We are going to give you some fresh frozen plasma, which should also help with the swelling because this type of reaction doesn't always respond to some of the medications that you were given in the ER. So we're going to do that. That should improve your symptoms. And also when it comes to your blood pressure, we want you to continue your at-home blood pressure medications, but we are going to discontinue the benazepril. Continue your statin for your cholesterol, and in the hospital tonight we are going to give you those medications as normal, and then follow up as normal with your primary care provider. And I also wanted to talk to you about some screenings that you should do now that you're above the age of 50. If you haven't already, we can't see everything in our system if you had it done at a different hospital, but you're going to want to have a colonoscopy just to check for colorectal cancer. And seeing that you are a male above the age of 52, it would be good to check a PSA and do a prostate cancer screening. So those are just two things to keep in mind in the back of your head. Maybe discuss with your primary care provider next time you see them. And yeah, we're waiting on your lipid panel right now. We're just checking to make sure your cholesterol is looking good and that your statin medication is controlling your cholesterol well. Continue to eat a good diet. Try to eat healthy. Continue exercising like you have been. But yeah, everything else on exam and lab wise looks very good, but we just want to get that lip swelling to go down. Okay, thanks.